Welcome to Med-Surg Mini number 3 on osteoarthritis. Osteoarthritis is a connective tissue disorder that causes breakdown of connective tissue in weight-bearing joints. So this would be our knees, our hips, our feet, our spine, our fingers, and our toes. It can also occur in other joints if there's been severe trauma or injury to that joint. This is the most common form of arthritis in the United States and the one leading cause of disability in the United States. How osteoarthritis develops is you have tendons and ligaments that stretch. As that happens, the cartilage becomes damaged, and this cartilage is usually a protective factor for joints and provides cushion. But as it becomes damaged, osteocytes form and try to repair that damaged cartilage. This increases bone growth that impairs joint function and also causes pain and can decrease the range of motion of that joint. This osteocyte also causes the formation of spurs, which are bone fragments that break off of the bone and sit in that joint and damage the cartilage further. As the cartilage becomes more and more damaged, your synovial fluid is also going to thicken to reduce the effectiveness, and that can cause pain and pressure as well. Risk factors for developing osteoarthritis include age, especially older age. Gender, we see it more commonly in females. Being obese. Ethnically, Caucasians experience it more. Having an occupation where you're engaging in frequent repetitive movements, especially in those weight-bearing joints, like lifting things, bending up and down, and also engaging in high physical labor. Interacting in different sports. Having previous injury. Having muscle weakness. There does seem to be a genetic link to osteoarthritis. Having another form of inflammatory arthritis is a risk factor, and having any bone and joint disorders. Symptoms of osteoarthritis include pain, decreased range of motion, tenderness to the touch, swelling, especially in the joint and soft tissue surrounding that joint, having joint deformity, having crepitus. So what crepitus is as you move that joint, it kind of crackles. Joint looseness, muscle atrophy, and cyst formation around that bone. So diagnostically, we can engage with some lab testing to rule out other causes, and we can measure any inflammatory markers. From the radiograph perspective, we can see joint space narrowing, sclerosis and cysts that form around that bone, and we can also see those osteophytes. Nursing problems related to osteoarthritis include impaired mobility, pain, impaired ADLs, body image impairment, especially if they have the deformities that develop from osteoarthritis, exacerbation of chronic illness. They can have an unsteady gait, fatigue, and ineffective sleep patterns. Our treatment would be to provide mild to moderate pain management through Tylenol. If they have more severe pain, we can do corticosteroids injections, which aim to reduce inflammation by suppressing leukocyte migration to that joint. We can have hyaluron injections, which aim to increase lubrication of that joint. We can use opioid analgesics and surgical management, like joint replacement and irrigation and debridement of the spurs within that joint. Non-pharmacologically, we would recommend weight loss, hot and cold application, aerobic exercise, physical and occupational therapy, use of assistive devices, and specialized footwear. Our evaluation as to whether or not our nursing interventions were effective would be, is the patient able to maintain function as best as they can? Have we controlled pain? And have we reduced the risk of long-term complications and negative outcomes? And that concludes our discussion on osteoarthritis.